This is Care That Never Quits, presented to you by Goodwill Staffing.
Welcome to Care That Never Quits, the Goodwill Staffing podcast. It's a space where heart meets hustle and the people behind the care take center stage. I'm Shannon, and I am thrilled to be kicking off this journey with you. Because, let's be honest, if there's one group holding the entire healthcare world together with skill, patience, caffeine, and just pure willpower, it's nurses. This show is for you, the ones who run toward the need, who show up when others check out, who manage crises with clinical skill and still somehow remember who likes their ice chips crushed. Whether you're deep in your third night shift, heading to clinicals, or just here to feel seen, this episode is for you. I want to rewind a bit. When you hear the word nurse, what comes to mind? For some, it's Florence Nightingale and her lamp. For others, it's that one nurse who changed everything. Maybe a couple of you can even think of a close friend or a family member that's cared for you at your lowest point, giving you warm soup and comforting words. The truth is, nursing is more than a profession. It's a legacy. From battlefield med tents to modern-day trauma units, nurses have been the bridge between chaos and care. Nurses have advocated for us when no one else would. They've innovated when tools didn't exist. They've comforted patients, trained colleagues, managed crazy family dynamics, and run codes all within the same shift. Nursing is a calling that demands more than skill. It requires grit, heart, and a second sense for anything unspoken. This legacy continues today, not just in textbooks, but in scrubs, sneakers, and lived experience. In you. So, what does nursing look like in 2025? It looks like a lot more tabs open than anyone signed up for. It looks like clinical excellence paired with emotional triage. And yes, still managing to smile through all of it. You're logging vitals, adjusting meds, translating physician talk into patient-friendly language. You're calming anxious families and maybe, just maybe, getting a bathroom break if the stars align. And it's not just the patient load, it's the emotional load. The moments that stay with you, the weight of choice, the ache of compassion fatigue. It's the invisible bag you carry home after every shift. And here's the thing. Nurses don't just adapt, they evolve. You become leaders, mentors, advocates. You take on public health, tech integration, wellness initiatives, and even policy. You're at the center of what makes healthcare work, and yet the system sometimes feels like it wasn't built with you in mind. And that's where we come in. At Goodwill Staffing, we don't just nod along from the boardroom. We've been in the supply room trying to find a working pulse ox. We know what it's like to have a short-staffed unit become just you and the ghosts of your coworkers. And that's why we don't see nurses as placeholders. We see you as the pulse. Let's talk empowerment, but not the poster kind, the real kind. Because when we say empowerment, we're talking about having a say in your own life and in your career. The difference between surviving your career and actually loving it. Empowerment means being able to say yes to shifts that fit your life and not just your unit's needs, and no to burnout without fearing retaliation. It's being able to say what's next instead of saying what now. It means having resources to grow, pathways to follow, and mentors who don't just tell you what to do. And it means being treated like the deeply educated, emotionally intelligent, technically brilliant human being that you are. That's our job, to make sure you're not just filling a gap, but forging a path. We make sure that path is clear of any roadblocks, that you don't have to run that path quickly, but instead get to take in the sights and breathe in the air. We want you to have the break that you work so hard to enjoy. Because at Goodwill Staffing, we've lived the double shifts. We've clocked out emotionally drained and still had to make it to PTA meetings, dinner with friends, or find 5 quiet minutes in the grocery store to buy some actual food. We've seen the pressure and we've turned it into purpose. So we're not clapping from the sidelines. We're building the kind of support that we wish we had when we were on the floor. And while some companies measure success in placements, we measure it in people. People who feel confident, cared for, and clear about what comes next. Nurses carry more than charts and stethoscopes. They carry questions. They're quiet ones, persistent ones, like, did I do enough for that patient? Where will I get the energy to keep going tomorrow? Am I going to get a chance to see my family this week? The thoughts aren't rare, and they build shift after shift, hour after hour. A single worry becomes the rhythm in the background of your life, and it echoes through the silence of the drive home or the few quiet moments you have before you fall asleep. As a nurse, you're expected to be strong, to be calm, to have answers, but sometimes even the best of us can't keep up. The pressures add up, not just from patient care, but from everything outside of it. Bills, paperwork, missed birthdays, student loans, the question of, am I losing myself in all of this? It's really no surprise that this quiet burden that you carry with you over time can begin to wear on you, can dim the joy that you used to find in the work, and turn everyday choices into overwhelming decisions. The hidden weight is the weight many nurses bear. And if this feels familiar, you are definitely not alone. At Goodwill Staffing, we know the weight that's on your shoulders, and we're not here to add one more thing to your plate. We're actually here to help you take some things off of it. We handle the heavy logistics so you can focus on what matters most: your patients, your loved ones, and yourself. The world may expect you to handle everything, but we don't think you should have to do it alone. And when you feel like you're running on empty, we can step in and refuel what's been poured out. Our recruiters will help protect your time, ease your mind, and preserve your passion, because your care doesn't just heal, it inspires. At Goodwill Staffing, we don't just support nurses. We're here to walk with you every shift, every challenge, every step of the way. Now, let's talk about Nurses Month. First of all, it shouldn't just be a month or even a week within a month. It should be all day, every day. It's not about cupcakes in a break room or a banner taped above a clock. Though, if you are getting cupcakes, I do fully support that. Nurses Month is a moment and a pause, and it's a reminder to say, we see you. And not in a passing once a year, human resources approved kind of way. It means we really see you. At Goodwill Staffing, every month is Nurses Month. We see you every month, and we appreciate you every week. We see the nurse who's training 2 new hires while running her own patient load. The one who caught a med error at 3 a.m. because her gut said, check that. And the one who stayed late just to make sure a scared patient wasn't alone. You didn't ask for parades or cupcakes, but you deserve the recognition that lasts a lot longer than a donut run. We don't just appreciate what you do. At Goodwill Staffing, we are investing in who you are. So whether you're brand new with fresh scrubs and nerves to match, or you've been doing this long enough to know exactly how to silence an IV pump with a well-placed elbow, this moment is for you. You're the heart of healthcare, and we're here for you. At Goodwill Staffing, we're not just about filling roles. We're about building careers, developing growth, and making sure you never feel like you're doing this alone. And why do we get it? Because we're nurses too. We're founded by nurses, built by nurses, and still led by nurses. We've clocked the long shifts and felt the stretched thin moments. And yes, we've made it through night shifts with nothing but vending machine coffee and those free cupcakes. So if you're ready to start working with a staffing partner who actually gets it, who speaks fluent nurse, who laughs at your shift memes, and who brings snacks to meetings, come find us, because together we care better.